If you're thinking about becoming an ICU nurse or you're about to start your first ICU job, I want to tell you everything I wish someone told me before I stepped on the unit. They're the lessons I learned the hard way. Hi everyone, welcome to my channel. If you're new here, my name is Jude. I am a registered nurse living in the Big Apple. I've been a nurse for the past 5 years. I've worked in the emergency department, different ICUs, but when I look back, there's so many things that I wish I had prepared for. So let's get right into the video. The very first thing I wish I knew is that not all ICUs are created equal. And this is why it's important to do your research. If you want to become an ICU nurse, research different hospitals, intensive care units, or at least organizations and know what they specialize in. For example, in New York City, there are ICUs or hospitals that specialize in transplant care. There are ICUs that specialize or hospitals that have ICUs that specialize in cardiothoracic. So first, know what your goals are when it comes to why you're going into the ICU, or at least that's what I wish I did, and do research. If I could go back and start all over, the first thing I would do is research the hospital where I was getting or wanted to get my ICU experience. A great place to start is to research or get to know more about the hospitals that you're doing your clinical rotations in as a nursing student, searching different nurse extern programs that are available for nursing students to participate in. One great thing to research for hospitals is standards that are held for hospitals, CLABSI, CAUTI, their scores. It's very important to research that. Something that I learned is that a nurse is only as strong as, one, the education you get on your units, and two, the types of patients and conditions that you're exposed to. You can't go to a MICU if you want to be a CTICU nurse. It just doesn't work. The workflow, the critical thinking skills, just anything in general is different and ranges from ICU to ICU. So know what your goals are and do as much research as you can on the different hospitals, or at least the different areas of interest or things that you'd like to be exposed to as a nurse. Another great thing when you're doing your research is you want to go to teaching hospitals, magnet designated hospitals. Just learn or do research about the culture of research, and remember, your nursing skills and experience is only as good as what you're exposed to. You cannot be a top tier CTICU nurse if you're in a hospital that does not specialize in cardiothoracic surgery. Just keep that in mind. 2, you need to learn time management. If there is something that I wish I had learned sooner, it is time management. And again, everyone is different, but it is super duper important to know how to prioritize when you are working in the ICU. I mean, think about it. You have critical patients. There are tons of orders. There are tons of things to do. You need to get things done in a timely fashion. Lab work, assessments, medications, titrations. There's so much to do, and of course, when you're starting off new, you want to take your time and you have a preceptor that's there to help and guide you, but it is so important that once you start getting, a bit of experience, that you are making sure you are prioritizing and also delegating. Ask for help. Please do not try to be super nurse. You are one person. You should not be trying to do 8 things. Use your resources. Ask for help. It is okay to ask for help. You do not look dumb asking for help. You actually look crazy when you're running around the unit like a chicken with their head off, because you want to draw blood work and you want to make sure that your titrations are in properly, and you still have to make sure that you put the I's and O's in. Oh, but you also have a blood draw or a blood sugar to check. Oh, but you also need... No. There are different people on the team for a reason. Use your resources. Ask for help. Emergency department, ICU, wherever you work. Use your PCTs, your PCAs. If you need an EKG done, ask another nurse on the unit to help you with the EKG. At the end of it, again, in the ICU, we are working with critical patients. You don't save a life all on your own. There is a team of doctors, there is a team of people. Use your resources to support you. And here comes my other point. Ask questions. Do not be afraid to ask questions and find out the people who are there to support you. I feel like if you're a brand new nurse, it is very important to make sure that you get into a nurse residency program. A lot of hospitals offer nurses who are new to bedside nursing or acute care, inpatient ICU, whatever specialty, 1 year, usually of a type of nursing residency program to help with that transition from school to bedside. Use those resources. Get to know your nurse educators on whatever unit that you're going to. Get to know the nurse managers. Get to know the senior nurses too. Like, introduce yourself. Make a good impression. Being polite and introducing yourself goes a long way. If you come on a unit with a good attitude and positive energy and introduce yourself, just try to set a good impression. I don't even know what number this is. Learn how to do a proper head-to-toe assessment. I don't know who you need to watch. I don't know if you need to pull up registered nurse RN, nurse Sarah. Go on YouTube and find a video about how to do a proper head-to-toe assessment on an ICU patient. ICU, majority of your time, your patients cannot talk to you, right? They are intubated, they are sedated. The only thing or only way to know how your patient is doing is to know how to assess them head to toe. Their neuro status, their respiratory status, right? Understanding the different settings on the ventilator, understanding or trying to know what type of pain your patient is in, because that could affect their heart rate, that could affect their blood pressure. You need to assess your patients, right? Intake and output. What is the patient's fluid status? Are they dehydrated? What type of rhythm are they in? These are all things that, going into the ICU, you do not need to know everything. You do not need to be an expert, but you have to be open-minded and willing to learn. Ask your preceptors how they do it, or learn how to do it, and then again, watch a video on YouTube. And when you get onto the unit, the nurse, remember, you are the one who's at bedside 12 hours. You are the one who's going to be taking care of that patient. They cannot speak. You are there to speak and advocate for them. And another thing with the whole head-to-toe assessment, make sure you understand labs and how that correlates to what you see. I feel like this is getting a little all over the place. To recap, 1, you need to research the hospital that you want to go to, research the type of ICU units or specialty care that they provide. If you are interested in cardiothoracic ICU, make sure that the hospital that you're applying for or interested at working at specializes in cardiothoracic surgery. It just makes sense, right? So do your research. Number 2, time management skills. Learn how to prioritize. 3, remember, you are not super nurse. Ask for help. Ask questions. Use your resources. Do not try to be super nurse. You have nothing to prove, okay? Well, you may, but you're new, okay? There are things that come with being new to anything. You're not going to be perfect in the beginning. You are learning. Be patient and kind with yourself. Do not try to be super nurse. You will burn yourself out. I'm speaking from experience. And then you wonder why 5 years into nursing, your back is broken and you're using a cane. You heard it from me first. Ask for help. Why are you trying to turn a patient Q2 hours by yourself. Why? Exactly. I'm parched. Another thing that I wish I knew before really getting into the ICU is the importance of building relationships with experienced nurses. Guys, you are new to this, not true to this. They can be mentors for you, they can help you, they have more experience, they can guide you. Network, connect, and make sure that you are using them as a resource when you're on the unit. Hey, Nurse K, I'm just did this EKG, or I want like a little bit more help with this EKG. Do you think you could just like take a look or something? Just ask questions. Experienced nurses respect those who are willing to ask for help and not people who act like know-it-alls. Learn why and not just how. When you are in the ICU, you will be exposed to ventilators, to different types of machines, different types of medications that are used for sedation, that are used for blood pressure management. Understand the why and not just the how. Yes, this patient's blood pressure is dropping. That's why they are being put on medication to help with their blood pressure. Okay, i.e. what? Levofed, vasopressin. Try to understand or connect the dots. Okay, my patient is in septic shock. Therefore, they need medication that is going to help bring up their blood pressure. Wait, but what if my patient's in hypovolemic shock? That's different, right? Not only might I need medication to bring up their blood pressure, Levofed or vasopressin, but they might need fluid replacement because they are low in fluid, hypovolemic. Whether that be fluids like lactated ringers or normal saline. Try to connect the why to how. You shouldn't just be carrying out orders. You need to understand why, or you're doing what you're doing, because the orders should make sense. Because remember, you are the last line. Meaning, if the doctor made a mistake with what they ordered, you're the last person to catch it before the patient gets that. If their potassium is 5.5 and the doctor puts in a K writer, you should be able to be like, wait, let me look at the patient's last potassium level. It was 5.5. Why would I be giving this patient a potassium bag that's going to bring their potassium levels up more? Let me go ask the provider, hey, just to clarify. You see where I'm going with this? There you have it. Take care of yourself. It's very important to take care of yourself. Eat. Take breaks. Have snacks. It's very easy to give in nursing, and sometimes you can forget to drink water. You have a busy day, but just always remember to take care of yourself when you're at work, and especially when you're outside. If that's a spa day, if that's just sleeping in a little bit more, if that's eating an extra meal, take care of yourself. Exercise, walk, read, do anything that helps calm your nervous system, that helps relax you. You should have very good self-care habits, because you cannot pour from an empty cup, and I wish that I took this advice sooner. It'd save you so much from feeling burnt out, from feeling stressed. Have an outlet outside of nursing. Definitely never stop learning. Whether you go into the ICU or any other type of specialty, there is so many different things you can do. Certifications that you can get. CCRN, CMC, CSC. If you want to be in the emergency department, you can get your CEN. If you want to be a board certified med surg nurse, you can do that too. Never stop learning. It looks great on the resume. You become strong nurse on your unit, and you actually get paid more money when you have certifications. So definitely look into that. Expand. Always remember, nursing is lifelong learning, and these are just some of the things I wish that I knew a little bit before I got into critical care ICU. and I hope that this helps someone out there. Stay tuned for my upcoming videos. I'll be doing some videos on studying for your CCRN, CEN, and much more. If there's anything that you'd like me to speak about or any questions you have, please feel free to comment down below, and I'll see you guys in the next video. Bye.